Welcome to Spotlight on Migraine, hosted by the Association of Migraine Disorders. Join us for fresh perspectives by medical experts and advocates as we explore the spectrum of migraine and dig deeper into this complex disease. Thank you to our 2023 education sponsors. Migraine affects about 11% of children and adolescents, but it can look different for migraine in adults. Dr. Michael Oshinsky from the National Institute of Neurological Disorders and Stroke discusses the signs and symptoms of pediatric migraine, as well as ways to support children at school and with their personal lives. He also talks about treatment options and how the NINDS Migraine Trainer app can help with the management of the disease.
Hello and welcome to Spotlight on Migraine. I'm your host, Molly O'Brien. We know that migraine can affect people at any age. So today we're looking at how migraine impacts young people. We're talking about kids and teens. So to help us learn more, I'm pleased to introduce our guest, Dr. Michael Oshinsky. Dr. Oshinsky is the Director of Preclinical Pain Research at the National Institute of Neurological Disorders and Stroke. Dr. Oshinsky, thank you so much for joining us today.
Molly, thank you so much for having me. I'm really excited to speak to you about pediatric migraine headache in kids and teens. I think it's a really important topic.
It is an important topic and a hot topic among the migraine community right now. I think more people are really interested in finding out, hey, what resources are out there for my kids? What do symptoms look like? All that. So we're going to dive in. But before we do that, can you tell us just briefly a little bit about your background?
Sure, Molly. I got my PhD at Cornell studying computational neuroscience, sound localization in small arthropods, if you can believe that, and did my postdoc at University of Pennsylvania studying circadian rhythms and drugs of abuse. And then I joined the faculty at Thomas Jefferson University and the Jefferson Headache Center. And for 14 years, I studied headache in a clinical population and in rats in order to, develop better platforms for developing treatments for migraine. So with the caveat that I'm a basic scientist, but I spent a lot of time around migraine patients and some of the best clinicians in the world who treat headache at the Jefferson Headache Center.
I love that your background is so interesting and that you're a basic scientist here at the Association of Migraine Disorders. We love research. We love advancing research. So excited to talk to someone who's out there getting it done. All right, so let's jump into our conversation all about pediatric migraine. We know that migraine is the most common headache disorder in children. Roughly how many young people have migraine?
So it's pretty surprising for some people to hear that between 7 and 8% of all children have migraine. Wow, that's almost 1 in 10. Now, when a child has a headache, sometimes it's difficult for them to communicate that they have that headache. And sometimes they focus more on the GI symptoms and they'll complain more about a stomach ache or being nauseous, which is an associated symptom with migraine. But a good physician knows the questions to ask to really get at the root cause of all those associated symptoms.
Absolutely. And because migraine can look different at different ages, we're talking about infants, toddlers, and teens. The symptoms can look different and it doesn't always come with headache. So you mentioned nausea, GI symptoms, but walk us through what migraine can look like at these different age groups of young people.
So those of your listeners who have experience with adult migraine may be familiar with the adult criteria for diagnosing migraine, a headache that lasts 4 to 72 hours. So if it lasts less than 4 hours, it doesn't necessarily fall into those strict criteria for diagnosing migraine in adults. But in a pediatric population, it's actually pretty common for those headaches to be shorter lasting than 4 hours. And then some of these associated symptoms, which I mentioned earlier, that nausea. So it's actually pretty uncommon for adults with migraine to actually vomit, but in children, it's very common. And then the headache will even resolve after they vomit, which doesn't typically happen in adults either. So there's, some of the GI symptoms are more exaggerated in a pediatric population than adults. And then a migraine of lasting only 2 hours long is okay to diagnose it as a migraine in the pediatric patient, whereas an adult it wouldn't. Now we're talking about children that are very young teens or younger than that. Once you get into the later teens, after the either boys or girls have reached puberty, then their symptoms kind of start to line up with what we see in the adult population. And that's a really important point, since I brought up boys and girls. So in the adult population, we know there's a 3-to-1 ratio of more women experiencing migraine than men. But if you look in very young children, let's say under 10 years old, the ratio is pretty much the same. And it doesn't change until the girls reach menarche. That means they start their menses. So that's when you start to see more girls experiencing migraine than men, and that's probably due to a hormonal trigger for those attacks.
More evidence pointing to those hormones being involved.
But not the only issue, because we do have those boys and those adult men that do suffer from migraine, and they do suffer.
Absolutely. So we're talking a little bit about that teenage group. Teenagers really seem to have it tough sometimes. So many physical changes going on in the body. Can you tell us what are some of the common symptoms that teens live with, or that parents might be able to recognize if they don't really understand migraine?
So those of us who have teenagers or teenagers with migraine know that irritability is a big symptom, especially during or immediately post a headache, what we call the postdrome. So that the only symptom, don't look at pain as the only symptom of migraine. Migraine is a neurological disorder that has lots of neurological manifestations. And those neurological manifestations are not only in personality or mood changes or in pain, but they're also in other organ systems, like we mentioned earlier, the GI system. Slowing down the GI, and anorexia means stopping eating, is during the attack is also really common in adolescents during their migraine attack. Now, having trouble sleeping or getting those 8 hours a night, which are recommended by all the professional societies from the on the physician side, is really difficult in this population. And not keeping a set sleep and wake time, even on the weekends, is can be difficult, make it difficult to manage migraine in an adolescent population. So that's the Saturday morning headache when you sleep in to noon, or the Monday morning headache where you got to get up early again for school. So these triggers, and these are really, so sleep changes associated with migraine, there's GI issues, irritability, just being a difficult teenager, hard to separate that from migraine, but it can really be exacerbated. So the parents understanding what the children are going through, not just associated with their hormonal changes, but also really not stigmatizing this pain they're experiencing that's absent of any organic or tissue damage, right? So you just look at your child, they look young, they look healthy, they're active with their friends, but when they might have a test due, so they have this stress trigger, and then all of a sudden they start complaining about their head and their stomach, and they can't go to school, and no, I can't do the test, I can't even think straight. So the cognitive symptoms and the cognitive slowing and fogging that's associated with migraine is real. So to not stigmatize them for that is really important.
I think that's so valuable to talk about, not stigmatizing or just think your child is trying to get out of a test or a big assignment, because that often can happen. It still happens with people, with adults. We still face that stigma, like, I can't go to work today because you're too stressed, you're too overwhelmed. So I think that's really, really valuable information to share. And yeah, maybe you start seeing a pattern of this happens around every big stressful event. So that can help too. Let's talk about keeping a routine, having some consistency with sleep, with eating. Like you said, kids don't always have that, whether it's on the weekend or even the summertime when our kids have the opportunity to have free time or go to camp or all the other fun, cool stuff you can do as a child. So when there are schedule changes, what are some good things that parents and kids can do to kind of help stay consistent, to reduce the risk of attack or prevent attacks?
So let's talk about changing from school to camp, which is, that we're at the beginning of the summer, ending school recently. This is happening with lots of families, or maybe even going on vacation. There's going to be a change in routine. So try to minimize which changes you have, right? Whereas there might be a change in sleep schedule, but keeping that feeding schedule consistent, right? Or the types of food consistent. So we know that when we're traveling, we know that when we're no longer eating those school lunches, which has a pretty set routine, that we can gravitate to foods, and maybe to the foods that are more comfort foods, which in some individuals can trigger headache. And I don't want to say that headache is only triggered from external factors like food, et cetera. There are internal triggers and changes in physiology that can lead to them. But an individual, knowing themselves, should be really careful about what they eat if they have migraine associated with triggers. And there are also allergies. There's allergies to particular foods, and they can manifest as a trigger for a migraine also, which we see in pediatric populations. And this is really important. Kids can give a pretty good headache history. And when a physician or when a parent is trying to, get the information together in order to compile it, to give it over to their physician, or when the parent joins the child in discussing their headaches with their physician, is to let the kid talk, because they can give subtleties in answering those questions from the physician that the parents, they can just be really surprised about those answers. Now, clearly, when it comes to family history, or when it comes to, the perception of how the lifestyle has changed associated with the headache, the parents are absolutely essential there. But we could also learn a lot from our kids about what they're suffering by just listening and not assuming it's like our disorder if we have migraine and projecting it on them.
Oh my gosh, that's such a valuable piece of advice to actually, if your child can talk, some kids who experience migraine are not speaking yet. So
True.
I think that's
that's a good point. If you want to talk about, let's talk about migraine in infants, right?
Absolutely.
So there are some associated symptoms that we're finding in the research in this population. And one of them is torticollis. And that's a tilting of the head in infants, which is actually pretty common. And it's something you should discuss with your pediatrician. But if you're also seeing feeding changes associated, sometimes the child leans their head to the side and sometimes doesn't. That could be associated with head pain or episodic migraine in that patient. And then that can help the pediatrician or the pediatric neurologist treat that symptom or treat that pain in the child, and then they can straighten up their head, and then they can get back onto a regular feeding schedule also. So one of the things that they found is that if you look at young children when they start to be able to communicate whether or not they have a headache, and you look at their history, torticollis is actually pretty common.
Wow, that's fascinating. And always interesting to think back too, like, why is my child acting like this? Well, there could be some explanation. So
also by in a lot of parents' experience, they said, well, my older child didn't do this. Right? So they try to project with one child onto another. And, for those of us, have multiple children, they're all different. Even though it's just so natural to project what the expectations are from one to another, you have to look at them as individuals.
That is great advice. Parenting is hard. I'm learning
Very difficult every day.
It is hard. It's rewarding, but it's hard. So let's talk a little bit about some treatment options among various age groups. Again, always good to talk to your doctor, your pediatrician, your healthcare provider. But there are treatment options out there for young people, as well as, lifestyle changes, medications, non-medicated devices that are cleared. So let's talk about what options that young people with migraine have.
First of all, many of the treatments, not all of them, but many of the treatments are used off-label. That means they don't necessarily have an indication or approval from the FDA for this particular population. Some of them do, right? But and then there's contradictory clinical trials, which is also really difficult. So one of the things that's really important to do is to find a physician who has experience treating headache in your child's age group. All right. And then they're going to be the best resources to trying to figure out what's appropriate for the child, and then how to balance side effects or off-target effects associated with that treatment that your child, may have the potential, to experience in the context of, the benefits that we'll get in relation to their headaches, et cetera. So there's a whole slew of options, and you should know there are lots of choices. And I'm going to start with behavioral interventions first, right? Lifestyle changes. That's what we discussed earlier. But there's also behavioral interventions for having the child deal with the pain, and then, gaining that mastery over understanding what they're suffering, understanding their disorder, and being able to manage it from that perspective standpoint. Their headaches become better and less frequent, right? So cognitive behavioral therapy is one example, CBT. ACT is another one, assessment commitment therapy, right? So that's another one that's associated, and that has some pretty good evidence in migraine also. And then we have trigger point injections have been, seen as successful in some adolescent patients. That mean those are either lidocaine, and sometimes they use lidocaine with steroid, where they treat the trigger points, some sore points in the neck, some sore points in the head. So those muscle contractions can be a sign of overexcitability in the trigeminal system. That means the sensory system that processes from the head and the neck. And then there are medications that a child can take acutely. And one of the things we found is that if you treat the individual attacks, meaning really commit yourself to getting those attacks or those experiences of episodic migraine and treating those individual attacks, that they'll become less frequent over time. And then if we let them become full-blown or fully experienced by the patient, then the headaches can become more frequent. So headache begets headache. But if we treat it well, then we can prevent that also. So there's over-the-counter medications such as acetaminophen, which we have to be careful how often we use that because of potential liver toxicity. And then there's drugs that are non-steroidal anti-inflammatory drugs. An example of that is like Advil. And then those can be used in combination with prescription medications such as triptans, and there's a whole slew of different types of triptans that are used to treat individual headaches. And what's important is because the gut does slow down, so sometimes a pill isn't the best way to treat a headache. And it might be through a nasal spray or through an injection. There are auto-injectors that can be used for, from these triptans or these medications, or a dissolving tablet. So really, you got to speak to your physician. We got to talk about all the different symptoms that the patient is experiencing in order to find the right combination of treatments. And then there are the new CGRP antagonists, the small molecule antagonists, or the antibodies that are on the market. Now, they don't have approval in very, very young children, but in adolescents and in adults, they've really changed the landscape for treating headache in these populations, and also the lives that they live have really been transformed.
Absolutely. It's really nice to hear you talking about the options that are out there. Looking back on the years when I was a kid living with migraine, we just didn't have as many options. And I was one of the lucky ones who my mom advocated for me, let me talk, and knew that we had a history of migraine. So I got a diagnosis very early. But looking back, thinking, I'm so glad that there's so many more options for young people and for adults, obviously. It's a really exciting time. And
it's also devices, electrical devices for stimulating the arm, stimulating the ear, the vagus nerve, the forehead, the branches of the trigeminal nerve that innervate these areas of the face, neck, and head. It's just a really exciting time to be in the migraine field. Maybe not from the patient's perspective, except for the fact that there are more options, but from a research perspective and the physician's perspective, that they just have lots of tools in the toolbox.
Absolutely. So we'll say it's exciting from the patient side as well, because more options mean more tools. And let's talk about a tool that you all have. It's really cool because we can keep track of symptoms, we can keep track of triggers, and that can really be helpful for some. So talk to us about the Migraine Trainer app. This can be so helpful for kids and teens, and it's cool and easy to use as well. I've looked at it. But let's talk a little bit about the Migraine Trainer app, what it is, who can use it, and how it can help.
So let's first identify that tweens and teens, these age group love their phones. Okay.
Love
and
it.
They love interacting with their peers, and that's actually the number one information source for them, either their peers, social media for getting in, and social media getting information, which they're getting through their phones. The NIH was aware of that, and one of the gaps that we saw in all of the applications that were being produced in the different app stores, from either on the Android side or the Apple side, for helping migraineurs, were really focused on the adult population. So we chose to fill that gap, at least a little bit, with something that could give information about headache from really good sources, which is important when you're interacting with the internet or social media, to look at the source, and then also give suggestions for interventions and lifestyle changes that can help the adolescent deal with their headache. And then we put it in this package with these, great little cartoon characters that just have such a great attitude, something that the pediatric patient or those experiencing migraine can, really empathize with, right? So, the application's developed, by a really great professionals that do this for, a living, and we partnered with them to take the scientific expertise in that research content of what can be helpful for patients with migraine who are adolescents, and really help them to just manage their headache. So it's for helping for managing it from a behavioral perspective, and then also tracking it and it's something they also can communicate with their physicians, like a schedule of their history of headaches and how often they've happened and how they've treated them. So we hope it can benefit them.
Absolutely. It's nice to be able to have all of that content and resources right in one place on a thing that many, many people have their phone look at all the time. Well, before we wrap up, I'm curious, Dr. Oshinsky, if you have anything else that you want to share, any information with our followers out there.
Sure. What I wanted to say is sometimes individuals experiencing migraine feel like there's no options out there, especially if they've been to their primary care physician, especially if they've been to a neurologist who doesn't necessarily have a lot of experience treating pediatric patients with headaches. But rest assured that there are many, many different options, and there's no reason to give up hope that you can decrease your headache frequency, that you can eliminate migraine as a barrier for being successful in school and successful interacting with your peers, or that'll prevent you from sports. You can get treatment. There's lots of different options, like we mentioned: stimulators, injections, pills, behavioral changes, and then cognitive behavioral therapy, etc. A combination of them also might be helpful. So don't be afraid of that either.
I love that. Don't give up hope. There are options out there and you can access them. So I'd like to thank you so much, Dr. Michael Oshinsky, for joining us. He is with the National Institute of Neurological Disorders and Stroke. Thanks again for all of your wealth of insight and knowledge.
Molly, it's been a pleasure. Thank you.
Thank you again. And thanks to all of those out there watching and listening. We appreciate your support. That wraps up this episode of Spotlight on Migraine. I'm your host, Molly O'Brien. We'll see you next time.
Thank you for tuning into Spotlight on Migraine. For more information on migraine disease, please visit migrainedisorders.org.